The roots of hospice care in Marion County run deep. From pioneering nurses inspired by Elizabeth Kubler-Ross's groundbreaking book on death and dying, to a doctor who studied under the founder of the modern hospice movement, Dame Cecily Saunders. Marilyn Curran opened her own facility when she realized dying patients at the nursing home she oversaw were not receiving the care they needed. She recruited Ann Allen from the health department and Rita Hoffman, nursing director at the College of Central Florida. Another founding member was Dr. David Elliott, who had studied under Dame Saunders. He became the first volunteer medical director and continues today on the ethics committee.
Being a founder of Hospice of Marion County was a turning point in my medical career. I'm so proud to have been part of its development and growth for these last 40 years. Hospice truly functions as a team, including physicians, nurses, social workers, chaplains, and administrative staff.
As an all-volunteer, not-for-profit group, fundraising was always at the focus of their mission. From chicken purlieu dinners to the first important major donors, Bernard and Teresa Castro, founders and owners of Castro's Convertible Furniture. With those funds and a grant from United Way, Ocala Hospice was incorporated and moved into its first office, a converted garage, then to an actual building. The tide turned again when the state of Florida granted licensure on January 11, 1983, and Medicare granted coverage in 1986. At that time, the average daily census was 25 patients. Volunteers remained at the heart of hospice. One of the longest serving was Chloe Lindsay, who was profiled in the paper in 1985. Chloe only stepped down after 32 years when she became ill and passed on our service. Progress was rapid in the 1990s, with more fundraising efforts and the donation of 12 acres by local chef Roger Gerbeau for the building of 2 hospice houses, Sylvia's and Estelle's. By 1996, our current administration building consolidated 4 satellite offices. Staff rose to 118 professionals with 249 volunteers, headed by Alice Pravat, who served as president and CEO for 16 years. The dedicated board of directors has been at the helm of growth, particularly with Ken Daly, who has served since 2002, including 2 terms as chair.
So I keep on coming back to the board of directors of hospice, and I have for over 20 years, because I've seen firsthand how the expertise and the compassionate care of the entire hospice team benefits the patient and the family in the entire dying process.
HMC continued to expand with the creation of its own pharmacy and started new programs, transitions for patients who weren't yet eligible for hospice, and Camp Mariposa for bereaved youngsters. HMC picked up national recognition, such as the best places to work for 3 years running, all while creating new support services like Heartbeats, Inspirations, and Reflections. The mid-2000s was a period of tremendous growth with the addition of 2 new state-of-the-art hospice houses. The Legacy House on State Road 200, renamed the Cates House following HMC's largest donation. Within 3 years, the Tuscany House was erected in Summerfield, which received a national award from Healthcare Design. Tuscany also received a significant family donation and was renamed the Brandley House in 2015. Remarkable advances in palliative care came to HMC under Medical Director Picky Perez and ARNP Bonnie Parsons. Together, the 2 garnered numerous awards and brought palliative care awareness to local hospitals. Thanks to them, fewer patients have suffered needlessly.
So Hospice of Marion County gave us the opportunity to start a palliative care program. Palliative care means keeping somebody comfortable. And in medicine, we can't always fix you, we can't always rehab you, but we can always keep you comfortable. We had to educate the medical community, the hospital staff, as well as the community in large. Because of that effort, we went from 70 consults to 990 consults in just 4 years.
The success of the program escalated quickly from educating 300 people in the first year to 6,000. By now, the annual number of patients served rose to 2,500, with a consolidated staff across the affiliated companies of 450, plus 56,000 volunteer hours. With the retirement of Alice Prevett, the organization welcomed Mary Ellen Poe, formerly of Tidewell Hospice, to become HMC's third leader in its nearly 30-year history. During her tenure, Mary Ellen's focus was on community involvement and for providing the highest quality of care. HMC received accreditation from the Joint Commission in 2011. In subsequent years, HMC was given the deemed status recognition. Another focus was on a capital campaign and an annual fundraising initiative, shifting from events to major gifts to sustain our services for years to come. One such project was Vivian's Portico, added to the rear of the Legacy House to provide privacy and protection for patients and families. Becoming a member of the We Honor Veterans program gave new impetus to provide outreach initially for the greatest generation, but also to the many others who served our country. Headed by the Volunteer Department, the first veteran penning recognition was held in 2008. Since then, this touching ceremony has been performed by volunteer veterans in homes, facilities, parks, and streets. To date, more than 5,500 have been performed. In 2022, longtime hospice volunteer Tom Howard was named the We Honor Veterans #1 volunteer in the nation. He often performed pennings through windows and on driveways during COVID.
I can truly say being a veteran volunteer with Hospice of Marion County has been a fulfilling experience. Over the past 12 years, I've had an opportunity to meet with some fantastic veterans and their families, which leaves some fond memories.
Quietly in the background, hospice thrift stores popped up throughout the county. Known for its high-quality merchandise at bargain basement prices, with the friendliest salesfolk around, they have earned quite a reputation. And they provide $1 million a year to hospice, second only to donors in income beyond Medicare reimbursement. Over the years, HMC has garnered numerous local, state, and national awards for its program, its services, and most notably, its people. Mary Lasada, Chief Medical Director, has served hospice for the last 17 years. She was the recipient of the 2016 Catalyst Award from the Florida Hospice and Palliative Care Association. Challenging and unusual cases have made her a true advocate for the less advantaged.
Since I came to Hospice of Marion County 17 years ago, I was trained under the best, Dr. Elliott and Dr. Paris. I have seen our services expand to the most fragile members of our community. Infants as young as 11 days old, teens who have been in tragic accident, people with no coverage, no support, no resources, and most recently as part of the high utilizer team for emergency services in Marion County. And of course, people living with dementia and other cognitive disorders. We are truly meeting the needs of so many in Marion County.
Other milestones include the transformation of Sylvia's house into the Monarch Center for Hope and Healing on the Helen Mimi Walker campus. This grief center is a place of serenity and growth for the bereaved among our families and the community at large. Adjacent is the Memorial Park. A wall of names surrounds the military monuments and the Circle of Honor with a flagpole at its center. This was all started by 16-year-old Aaron Solomon, whose Eagle Scout project was to build a gazebo in honor of his grandparents. What a lasting tribute this young man inspired back in 2013. Animals have a huge part of the hospice heart, from our pet therapist, pet grief programs, and the Pet Peace of Mind initiative through the Volunteer Department, which ensures that pets of our hospice families find love, support, and even new homes. In 2018, Rick Bourne became the newest CEO of HMC. He came in with a burst of enthusiasm from his wealth of experience in hospice and home health. Rick's energy and expertise was a shot of adrenaline that was soon confronted by the onset of the pandemic.
When I arrived at Hospice of Marion County in December of 2018, I very quickly learned that this was not just a wonderful career move for me, but more importantly, I found out very quickly that the colleagues of Hospice of Marion County, the mission, the culture, were top-notch and one that definitely resonated with me. Together we have met all of the changes and stayed focused on what we do best, take care of people during the most difficult time of life's transitions. I make it a point to be part of the people who run the organization, from the board of directors to the leadership team to the medical directors to each and every one of my colleagues. I stay very busy. One of the best parts of my job is interacting one-on-one. I make rounds, checking in with as many of our colleagues as I can. I walk to their offices or visit various sites rather than picking up the phone and sending an email. I enjoy face-to-face contact and feel this approach works for all of us: transparency, visibility, and of course, accountability. I've enjoyed it all. You might see me dressed as Santa or Elvis, rocking to the 50s music at the Volunteer Appreciation Luncheon, and of course, as many golf fundraisers as possible. We are so appreciative of the community's support. Without hesitation, I can say that I love Hospice of Marion County. It truly is a hospice with a heart. I sincerely look forward to a very bright future. I just am hoping that it has nothing to do with masking or taking temperatures. We're done with that.
He met all of those challenges head-on, ensuring the well-being of our staff and the safety of patients during that trying time. Volunteers swung into action even though the thrift stores were closed and patient visits on hold. The sewing team made colorful cloth face masks, thousands of them. They also made gowns for the staff and had their husbands model them. Despite the travails of the virus, hospice still cared for more than 3,000 patients and families every year. And new programs were developed to meet changing healthcare demands. The Carrawell Supportive Care Team and the Nancy Renhart Center for Dementia Education. Norma's Nature Walk was created at the Cates House, and the opening of the fabulous new Grace Davis Hall House, due to the generous family donations, are the latest stars in the HMC constellation. With passion, promise, and preparation, Rick has led Hospice of Marion County into the future, and the future is now.